Okay, so again, our our course is NCM 106, Nursing Pharmacology, and actually Nursing Care Management 106 focus on the concepts and principles of pharmacology, which later I will discuss of what pharmacology is. It is also very important to consider that for a nurse to discharge her roles and responsibilities, the highest priority is basically safety. And in nursing pharmacology, the concept had been introduced in the second year level, first semester, since you will be dealing already with actual patients in the communities and most probably in the hospital. So, with the consideration of the aspects pertaining to how you will contribute as a nurse when it comes to learning the concepts, we always take into consideration the learning objectives and outcomes. So what are the learning objectives and outcomes? The learning outcomes of the nursing pharmacology for our discussion for this week is related to, at the end of the topic and given relevant, actual, or simulated situations, conditions, the students will be able to first explain the meaning of pharmacotherapeutics, pharmacokinetics, and pharmacodynamics. So these three concepts are very significant as an introduction to pharmacology, because if I will introduce this to you, it will be very easy for you to understand the classification of drugs in our succeeding discussion. Just like as when we talk about pharmacotherapeutics, if you have noticed, the terms that have been presented in our first learning outcomes is related to pharmaco, pharmaco, pharmaco. So obviously, if we talk about pharmaco, we are talking about drugs, we are talking about medications. Okay? Probably it's the properties that had been introduced to you during your first year level. It has introduced the basic concept in the biochemistry of the basic chemical properties. It is very important for all of you to go back on these foundations, simply because once we have reached the point of discussing specific drugs, you must know why I indicated or why I mentioned it's a must. Because the foundation of learning those concepts is very significant for you to continue your understanding on how these drugs will take action in the body, will take effect in the body, and how these drugs remove and eliminate excess of its properties out of the body. That's why when we talk about pharmacotherapeutics, from the term itself, therapeutics, the indication of the drug. What if you may encounter drugs that is new to you, then probably you have been familiarized in some of the TV advertisements or social media advertisements. So very superficial, but how this has been administered to a pediatric client and to an adult client. Are there any difference on that? If, for example, the drug that have been prescribed to your family members will ask you of the indication and what the drug is for, then the pharmacotherapeutics may give you idea in such a way that the drug is taking effect to the body and what is the indication of that. So sir, can you give me specific example? For example, when we talk about salbutamol, this is very familiar drug nowadays. Salbutamol is a respiratory drug. So very obviously that if this is classified as respiratory drug, the action of this drug is intended for the respiratory system. If it is intended for the respiratory system, what is the intent or what is the action or what is the intention or the intent of action of this drug to the person who's experiencing disequilibrium on health? Salbutamol could be a drug that will open airway passages. If you will notice, salbutamol nebulization or even those that are having stocks and preparation of syrup, its purpose is to open airway passages. So the next question is that of what is the problem of why it will open airway passages? It goes back to the situation wherein you need to know the basic foundation of anatomy and physiology. We are aware of the basic structure of the respiratory system. We have the upper respiratory system and we have the lower respiratory system. So the air passes through the nasal cavity up to the basic unit of the respiratory system, which is the alveoli. Now, since these are the passages wherein the oxygen passes through and the carbon dioxide is exhaled by the body, if ever situations like, what are those situations probably that may cause constriction of airway passages? May I ask our students, what are those situations that possibly may constrict airway passages and may lead to the possible difficulty of breathing?
Choking po.
Inhalation of first smokes.
One, I've heard about choking. Am I right?
Yes po.
Okay. So, choking from a foreign body, you're referring to choking from a foreign body?
Yes po.
Okay. So, if there will be choking of a foreign body, so are there any instance that that foreign object may irritate the tissues, the airway passage tissues? It may cause irritation ba? Yes or no? It may cause irritation or possible damage to tissues. So answer me back, yes or no?
Yes po.
Yes. Yeah, that's good. So why it may cause irritations and damage to tissues? The foreign body, that's why we identified it as foreign. It must not be in the airway passages because somehow it may cause obstruction. Am I right? The obstruction of that foreign body will not facilitate or may not facilitate entry of oxygen and removal of carbon dioxide out of the body. So, aside from that foreign body that causes the obstruction, there is a possibility that that foreign body, if in the upper respiratory tract or small airway passages, it may create pressure, right? It may create pressure to the airway passages. So just like, can you imagine the point that the carbon dioxide is increasing its pressure to be out of the body and the oxygen is increasing its pressure to enter the body. But the problem is we have the foreign body that causes obstruction to the airway passages. Now, with this situation, the air that foreign body can lead to aspiration. What do I mean by aspiration? From the upper respiratory tract, it may possibly proceed to the lower respiratory tract or to smaller airway passages. So if it will proceed to smaller airway passages, do you think it may cause friction? It may cause friction to the tissues of the airway passages? Yes or no?
Yes.
Yes po.
Now, if it will cause
Easily.
pressure to the airway passages, it may cause the what we call irritations. And that irritations may cause the possibility that there could be inflammation. The inflammation of the tissue may cause the possibility that we expect if there's inflammation, it will cause thickening of the tissue. If it will cause thickening of the tissue, do you think it will add more to the obstruction other than with the presence of that foreign body? Yes or no?
Yes
Yes
po.
po.
Yes po.
Yes. Other than the inflammation, the thickening of that tissue that may cause obstruction may cause the possibility that the irritation may cause the constriction of smaller airway passages. So what will now happen? What will happen now is that of carbon dioxide stays in the body. We learned in the anatomy and physiology that carbon dioxide must be exhaled out of the body. Am I right? Students, am
Yes
I
po.
right?
Yes.
Yes.
sir.
So do you think it will create a toxic effect to the body if the carbon dioxide stays in the body? Do you think it will
Yes
lead?
po.
Yes
Yes.
po.
So
Hindi na
it may
reduce.
Yes.
correct, it may cause harm. On the other hand, is there a possibility that the oxygen will not enter the body? Yes or no?
Yes po.
Yes.
Yes.
Yes po.
Now, in this consideration, do you think the person who's experiencing that, who experience and choke with the foreign body, will be deprived from oxygen? Yes or no?
Yes po.
Yes. So
Yes.
what is now the problem? Let's go now back to the problem. First, the problem is, with your knowledge of anatomy and physiology, there is an obstruction to airway passages, which initiated and initially caused by the foreign body. Secondarily, it caused irritations to tissues. It caused inflammatory response. Third, it causes constriction of airway passages. And now, we are aware that it will definitely cause what? Deprivation of oxygen and toxic effect of carbon dioxide. On that note, actually, the body can respond basically to resolve the problem. But with the presence of the initial problem of the foreign body, even the foreign body will be removed out of the airway passages. What is now in our mind of the pathophysiology is that of the foreign body already caused damage to airway passages. That's why it led to inflammation and constriction of airway passages. Here comes the point. Because of severe inflammation and because of the constriction of airway passages, the body cannot immediately respond. So there must be a way for or to supplement for the opening of airway passages. Supplement meaning the body will have compensatory mechanism. It means that the body will still compensate to open the airway. But at that time, it is not sufficient due to the severe damage of the tissues and constriction of airway passages. So that's why we will look for a supplement or for a drug that will mimic the compensatory mechanism of the body to open the airway passages. So what will be the drug? Salbutamol. Salbutamol will be given to the patient so that its purpose is to relax the muscle and open airway passages. So that is the basic concept of pharmacotherapeutics. Any questions so far? Students?
None po.
None? Okay, clear. So I will set more examples for you to understand pharmacotherapeutics. Another Are you aware of food supplements, multivitamins? No. Food supplements referring to, have you heard this in the most of the advertisements, na no approved therapeutic claims? Have you heard those?
Yes po.
Yes. Anyone can answer. How do you understand that phrase in the advertisement? No approved therapeutic claims. No approved therapeutic claims. Anyone? What could be your basic perception and understanding? Oh, why no approved therapeutic claims? If there's no approved therapeutic claims, kasi class, if you have heard that in the previous months, we've talked about vaccines, right? And we have the Food and Drug Administration to issue authorization and trials, authorizations rather, for these drugs or for these vaccines to be administered to the Filipinos are safe. But what does it mean when an advertisement shows no approved therapeutic claims? Anyone?
Pwede po mag-volunteer.
Sure.
Feeling ko po yung meaning nyo nun is that hindi pa totally completed yung research about it. Tapos yung ano niya, wala siyang hindi pa totally proven na effective siya in treating certain conditions po.
Actually, your basic understanding is correct. Why? To what extent? Di ba if you've heard those no approved therapeutic claims, ang gamot na to, hindi nakakagamot sa mga may sakit, ganyan. Di ba yan yung sinasabi? It's because that these drugs that had been labeled as no approved therapeutic claims cannot be claimed to be what? To be a treatment for a certain condition, which you have mentioned, right? You are right. Which you have mentioned that there's still no proven studies. Okay, there are still no proven studies that supports that directly and clearly it will treat specific disease or health condition. So that's why it's no approved therapeutic claims. So most of the no approved therapeutic claims that you will witness, you will encounter in most of the advertisements, ano yung mga examples of may mga no approved therapeutic claims that you have encountered?
Cherry fair.
Come again?
Cherry fair.
Cherry fair. Okay. Any other na may mga no approved therapeutic claims?
Herbal po.
Herbal. Very good. Any other?
Dietary supplements.
Dietary supplements. Very good. Kaya from the term itself, supplements, it only supports the body, but it may not be indicated as a treatment of a certain health condition. That's why the time that I have presented to you the concept like salbutamol. Okay, you can confidently answer me. It's a respiratory drug. It's a drug that will relax the smooth muscles of the bronchi to open airway passages. You're aware that when I say salbutamol, its indication is for respiratory problems and related to the airway passages. You're aware of it. But if I will mention specifically cherry fir, okay, you're familiar with cherry fir, pero what is in your mind? Diba? They have this promotion na when you have cherry fir, it will contribute to growth hormone. Am I right? It will increase your height. But
Yes.
it is on the now approved therapeutic claims because most of their what do you call this? Most of their support evidences are only for testimonies, from testimonials, but not from the perspective, just like with the vaccines that we are encountering now, di ba? Meron yang clinical trial 1, clinical trial 2, clinical trial 3, clinical trial 4. The clinical trials are the stages that will prove that the drugs are safe for humans. And this drug is indicated to support prevention of COVID-19. So it's clear. So that's why when we encounter such medicinal supplements, herbal supplements, they put no approved therapeutic claims because it may not consider as a direct support as treatment to specific conditions. Try to imagine also we are aware of, right? We are aware of some herbal medicines or herbal plants, right? And some of us, even with our grandparents, are supporting the use of those herbal plants as herbal medicines. But DOH only accepted very few because those example, what are those examples that have been proven na herbal plant that can support as a medicine? You're familiar with lagundi?
Yes po.
The lagundi is an herbal plant that is supported by the DOH and it passes through the clinical trials and given authority by the Food and Drug Administration that it is safe for humans. And we all know that lagundi is for what? Di ba lagundi is for the cough? Right? The ASCOV?
Yes po.
Yeah. That is the drug that which you are familiar, that is intended for respiratory problems, specifically on the cough. So those may separate our concept na pag no approved therapeutic claims, these companies will not claim that this is a treatment for diabetes. This is the treatment for hypertension if it is no approved therapeutic claims. If it has therapeutic approval by the Food and Drug, actually yung no approved therapeutic claims na mga drugs din ay ina-approve din naman ng Food and Drugs Administration. However, those drugs are only classified as supplements, but it may not have direct treatment on specific diseases. Unlike for the others that had passed through and qualified with the criteria that this is safe or these are safe for human consumption, those are with therapeutic approval. So that's the difference. Okay? And that will give you the idea on the discussion of pharmacotherapeutics on how these drugs will target this. Kasi if we will talk about pharmacotherapeutics, you may know the target system, target organ, target condition of the drug, why it is given to patients. Okay? So let's have another example. I know these are very common drugs which somehow some of your parents are taking. Or probably anyone can set an example. Any drug that you may know. What, come again?
Paracetamol.
Paracetamol. Okay. So paracetamol, familiar. Generic paracetamol. Biogesic, ano pa ba yung mga iba? Biogesic are brand names. Paracetamol is considered as generic name. Okay? So what's the difference between the paracetamol and the biogesic that I have mentioned? The paracetamol is generic as the basic classification of the drug, because the paracetamol is the one that we can search its action and its therapeutic action, while the biogesic is the brand name that will identify the specific manufacturing company. So class, don't be more anxious that you will memorize the drug. What you must be familiarized are more on the generic rather than brand names. Because, sir, why we have different brand names? It's because that will identify the manufacturing or the pharmaceutical company. And why the doctors are prescribing different brand names? Because the doctors probably may support this brand because it was tested, or it is in her or in his practice that it's proven that this is therapeutic for his patients or their patients. So
Nuhula po ng medyo.
So, so that's why they're being covered by medical representatives, for the medical representatives to explain the actions, to explain evidences that these are therapeutic to many cases. This has proven in high efficiency or effect to treat the certain type of conditions or health conditions. So yun, that may differ lang. But the paracetamol we're talking about is, if we say paracetamol, it's over-the-counter drug. So if we say over-the-counter drug, it could be accessed, it could be accessed without prescription. So it means it is safe that an individual can take a paracetamol. Now, can you tell me the indications when you are taking paracetamol? What are those situations that you're taking paracetamol?
Fever.
Fever, one. Okay, any other aside from fever? Headache, very good. Any other? So you have mentioned about headache, you have mentioned about fever.
Pain po.
Pain, very good. So pain, fever, and the other one, I forgot. Pain, fever, and headache. Okay, so probably the headache can be associated also with the pain. Now, actually, when you will we will identify the connection of pharmacotherapeutics to the paracetamol. Okay. Paracetamol, aware kayo because it has been a usual drug available in your own homes. These are the usual drugs that are available and given by your parents during your childhood or situations whenever members of the family experiences the health situations or conditions that you have mentioned. So when we say pharmacotherapeutics, you have mentioned about problem with fever and the problem with pain. Actually, these are the indications of the drug. And when it comes to the paracetamol, the action of which in the fever, it is considered as antipyretic. Now, have you encountered the term pyresis in your fundamentals of nursing? What do you mean by pyresis? Febrile conditions. Okay. So those drugs, so ibig sabihin, if the paracetamol is antipyretic, it prevents fever. Very superficial yung understanding natin with paracetamol. The pharmacotherapeutics will give us the idea, the hows and the whys the paracetamol is giving to the body or is giving to the person who needs to be administered with the paracetamol. And as what I mentioned, it's superficial that you are aware that this is for the fever and this is for pain. You are basically correct. But how? But to what extent that the paracetamol can both be a drug of choice for pain and the other a drug of choice also for fever? Because there's a common understanding. Go back again to anatomy and physiology. Okay? I know you have completed microbiology and parasitology.
Yes po.
Okay.
Yes po.
You studied about microbes. You've studied about viruses, bacteria, parasites. Are all of this, when entered the human body, may cause tissue damage?
Yes po.
Yes. But 'di ba may mga bacteria naman tayo that are helpful to the body. 'Di ba? Example, yung mga lactobacilli. Helpful 'yon sa body. But some of the viruses, bacteria, that once it enters the body, it may possibly cause a damage to tissue and possibly may have an effect when it comes to cellular function. Am I right?
Yes po.
Yan. So, basic example na that you are aware of, the virus. Very common symptom for a patient with COVID-19 is fever. Di ba very ano yan? It's somehow every time you enter establishments, every time that you enter school, one of the most common the question and frequently question that it will be asked to you, have you experienced fever? More than that, your temperature will be checked. Now, so one of the symptoms which is fever with the COVID-19 infection. Now, the virus itself, once entered the body, may cause specific damage to tissues. And eventually, pag nag-cause ba ng, if it may cause immediate damage to tissues, it may cause ba inflammatory response? Pag nag-damage ba siya, mag-inflammation ba siya? Yes or no?
Di ba dahil foreign siya, sir?
Foreign siya, it's not supposed to be inside the body, but for the virus to survive inside the body, the virus may depend, okay? The virus may depend on the tissues for survival when it comes to oxygenation, or probably the virus may mutate or replicate specifically or increase its number of the affecting site inside the body if the virus has this, first and foremost, if the condition of the person may not have the strong defense against infection, then that could possibly spread the COVID-19. And try to imagine that the COVID-19, the SARS-CoV-2, which is the virus, when it enters the body and it usually stays on the upper respiratory tract, what is the usual symptoms that the person may complain? Di ba throat irritation, throat pain usually. So there could be a starting condition that the patient may not have fever, but there's already a throat pain. So that's the time that wherein the virus are already and starting to have a damage on the upper respiratory tract tissues. And once this virus will continue to penetrate the tissues and may cause damage, when you go back to anatomy and physiology, any damage to tissues may release chemical mediators. Example of chemical mediators, we have 6 chemical mediators, one of which is histamine. The histamine that is released when there is tissue damage is the one that causes inflammatory response. The inflammatory response brought about by the histamine may trigger the prostaglandin. The prostaglandin is the one that once it will synthesize, it will now cause imbalance in temperature regulation. If it will cause imbalance with temperature regulation, then it comes a point now that the patient or the individual will experience fever. Question. When please try to check this in check this in any search engines, that the most common mechanism of action of paracetamol is to inhibit prostaglandin synthesis. Can you still follow my flow of discussion? Students, can you still follow me?
Yes po.
Yon. So, di ba? Okay, I'll start again.
Yes,
The virus enters the body. It causes initial penetration on the upper respiratory tract, which is more on the nasopharyngeal. Then it extends the damage going to the other respiratory tract because the virus causes damage to the tissues of the upper respiratory tract, and somehow the damage itself will release chemical mediators, one of which is histamine. Plus, di ba, if you will notice, if tissues are damaged, it causes redness. Can you observe? Did you observe that? Most of the
Yes po.
tissues na nag-cause ng damage, irritations, it leads to redness.
Yes po.
That is brought about by the histamine. That is brought about by the chemical mediator histamine. And here comes next, which is an indication that the histamine now is starting to lead to inflammatory process. Pag nag-lead yan into inflammatory process caused by the histamine, the prostaglandin synthesis, the prostaglandin is the one that will triggered by the histamine to be synthesized. At yung prostaglandin na yan, synthesis, tama. The prostaglandin synthesis is the one that may cause the possibility of the initiation of imbalance with the fever. Now, to prevent, kasi any damage with tissues, histamine will automatically release. What will be our mindset through that anatomical and physiological perspective? Alin doon ang dapat ma-prevent para hindi mag-cause ng imbalance sa temperature balance? Alin doon yung dapat i-inhibit? Alin doon yung dapat i-block?
Yung pag-ano ng histamine, sir?
Kasi pag there is inflammation, the histamine is automatic. Ibig sabihin, pwedeng hindi agad ma-inhibit. And that histamine kasi class meron din tayong drug na antihistamine eh. Pero if the histamine goes goes a fast pace na mag-lead siya sa pag-trigger sa prostaglandin at mag-synthesize siya, yung prostaglandin, the prostaglandin itself is the one that will trigger temperature imbalance and may not be regulated accordingly and may lead to fever. So let's go back. Histamine is released because of the inflammatory response, automatic. The histamine is the one that triggered the prostaglandin to synthesize. The prostaglandin is the one that will cause temperature imbalance. Which of the two, histamine and prostaglandin, is close that will trigger temperature imbalance? Is it histamine or the prostaglandin? Which of the two is close that will trigger temperature imbalance from the events or from the chronological events that I have mentioned? Anyone?
Prostaglandin.
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 Very good. So it means that the prostaglandin synthesis is the one that causes specific what? That causes fever. Now, di ba we have also associate that with pain? Di ba remember we have the inflammatory response? Yung histamine is the one, again, that triggered the prostaglandin. And the prostaglandin is the one also that may trigger, that will definitely trigger pain receptor and may lead to motor response of pain. So again, what is to be blocked? The histamine or the prostaglandin? Class? Dun sa perspective ng pain, histamine or prostaglandin? Anyone? No wrong answers. I will explain.
Histamine po.
Histamine for some, okay.
Prostaglandin
Prostaglandin is one.
Prostaglandin.
Okay.
Prostaglandin po, sir.
Okay, now, your answers are accepted, but eventually, the most that is close again with the perception of the relationship also with the fever is also prostaglandin. So that's why the prostaglandin, the histamine cannot be controlled. It will always trigger prostaglandin. So the prostaglandin is the one that will initiate problem with pain receptor at problem with thermoregulation. So the one that must be blocked talaga is the prostaglandin synthesis. Kaya sa pharmacotherapeutics, once you have the knowledge in anatomy and physiology, try to check the action or the mechanism of action of paracetamol is to inhibit prostaglandin synthesis. In a layman's term, if you will read that, sir, I cannot understand what's the action of that prostaglandin. Now you are aware that the prostaglandin is the one that triggers pain receptor that causes motor response of pain. And the prostaglandin synthesis is the one that triggers temperature imbalance that may lead to fever. So that's why paracetamol, okay, the paracetamol, the mechanism of action is it inhibits prostaglandin synthesis because we are aware that the prostaglandin is the one that is synthesized and trigger fever and pain. If the prostaglandin is already blocked by the paracetamol, will it manage? Will it manage already the temperature imbalance and the pain itself? Yes or no?
Yes po.
Yes.
Yes po.
Yes. So now, you can now answer confidently na, anak, para saan ba tong masakit ang ulo ko eh? Para saan ba tong pwede ba tong paracetamol? Mother, yes. Because it synthesizes it inhibits the prostaglandin synthesis. Because the prostaglandin synthesis is the one being blocked to trigger the pain receptor and gives motor response of pain. So probably your headache can be managed by the paracetamol. Anak, tinatanong ko lang naman kung para saan yung paracetamol. Pero probably your parent and your mom will be very proud of you if you will respond that detailed and clearly can explain to her that the logic why it caused that the paracetamol can be used for pain, it's because you're aware that the prostaglandin synthesis is the one that triggers the pain receptor. Any questions, sir? Any question po, students? Any
None
questions?
po.
None po? So it means wala po bang naintindihan? Or naiintindihan po clearly?
Naintindihan po, sir.
Ayan, thank you so
Naintindihan
much.
po.
Thank you so much. So number 1 pa lang tayo. Okay, next. Pharmacokinetics and pharmacodynamics. So what's the difference between the pharmacokinetics and the pharmacodynamics? If we talk about the pharmacokinetics, this is the concept wherein drugs are absorbed, drugs are distributed, drugs are taking action to the body, and excess of its properties are being eliminated. So that is also with the concepts of pharmacodynamics. Kasi from go back to your PE. Di ba kinetics and dynamics related is it related to movement? Is this related to movement? Yes or no?
Yes po.
Yes. Yes. So that's why have you wondered that there are drugs that is more effective if it is given under the tongue rather than swallowing it? Have you encountered that?
No, sir.
Yeah. Have you encountered or even observed situations that there are drugs, most for antihypertensive example, that are
Yes.
being given under the tongue, which is sublingual? It is better to give, or it is best to give it under the tongue rather than to swallow it. Let's go back to basic concepts of anatomy and physiology. Actually, this is related to the circulatory system. Okay? Do you know that the tongue or under the tongue is considered as highly vascular, full of blood vessels, right? Okay, that's why if there are any sores or damage to tissues of the oral cavity, specifically affecting the oral cavity, the tongue itself, di ba? The bleeding is profuse. The bleeding is parang it has a higher parang high volume of bleeding compared to other parts of the body. It's because it's full of blood vessel. Just the same with the nasal cavity. The more that the area of the body is highly vascular, the greater chances that may lead to bleeding. But the higher chances that it could be more effective for fast absorption. Kasi, do you know po that drugs will take its effect. The drugs are carried by the plasma. Okay? Are you aware plasma? Are you aware plasma? Plasma is one of the basic component of blood. Am I right?
Yes po, sir. Tama po.
Correct. And the plasma is the one that carries, for example, nutrients to the cell. And basically the plasma is the one that carries the properties of drug. So with the concept of plasma, when the drug will be swallowed rather than be taken under the tongue, or that is what we call sublingual. Can you imagine which of the two drugs may have higher chances of fast effect? Is it the one that is placed under the tongue or the drug that had been swallowed and proceed to stomach? Which of the two may have fast pace of effect?
Sublingual.
Under the tongue.
Yeah, because I know all of you agree with me, because the concept that I have addressed to all of you, that the drug properties are carried by the plasma. The more that the drug reaches the plasma, the higher chance that it will have its immediate effect. Kaya if you will notice and observe, which of the following routes of administration could be or could have higher chance of effect of the drug? 1, sublingual. So that's under the tongue. Okay. Second, oral. The drug will be swallowed and reach the stomach. Third, intravenous. Intra meaning inside the blood vessel, specifically the venous. Which of the three specifically can be expected with higher chances of effect of the drug? Letter A,
Intravenous po.
letter B,
Number
letter
3
C.
po.
IV.
Intravenous po.
Intravenous,
IV.
IV. Why kaya? Why you are, all of you are confident? You have majority of you answered intravenous. From my basic explanation, can anyone address the why is it more intravenous rather than sublingual rather than the oral? Anyone?
Sir, directly po kasi sa
blood.
blood.
Rekta na po, tsaka yung gamot po mas effective po.
Okay. Now, you have mentioned about direct. Di ba, we have mentioned a while ago that the drug, the basic component of the blood, which is plasma, is the one that carries the properties of the drug and may have its effect eventually and physiologically. So, the administration site that is closest to reach the plasma is the one that may have higher chances of effect of the drug. All of you are correct, intravenous. Why? Because obviously inside the blood vessel is the blood. And once the drug had been administered intravenously, the drug may reach the plasma, the peak plasma effect. So meaning it will have the fast effect to the indicated organ or system that the drug will have its indication. Rather than if the drug is taken orally, it will reach pa the stomach. If it will reach the stomach, it will be synthesized by the hydrochloric acid. If it will be synthesized pa by the hydrochloric acid, it will still be absorbed pa by the intestine. And the intestine, dun pa lang i-absorb ng blood vessel ng intestine para ma-distribute. But before it will be distributed, i-detoxify pa yung drug ng liver. And the liver, after detoxification, that's the time that it will have the pacing of distribution to plasma. So can you now understand the chronology of events? From oral, it goes to the stomach, synthesized by the stomach. After the synthesis of the stomach, it will be absorbed by the blood vessels of the GI tract, which is the intestine. And before it will be distributed, the liver will take place to detoxify the drug. And once the drug is detoxified and it is safe to be distributed, then that's the time pa lang that it will reach the plasma. So unlike for sublingual naman, for sublingual, before it will be absorbed by the blood vessels, it will still be synthesized by the enzymes under the tongue. And once it will be synthesized by the enzymes under the tongue, it will process pa before it will be absorbed by the blood vessel and reach the plasma. Unlike intravenous, the drug had been administered directly inside the blood vessel. Unlike kasi dun sa sa sublingual, outside the blood vessel, i-absorb pa siya going to the internal side of the blood vessel. Unlike intravenous, the drug directed to the blood vessel and blood itself carries the plasma to its indicated action. Any question? Clarifications? Students?
None po.
None
None po.
so far. So, are you so far learning from our discussion?
Yes po.
So, that's why when you take your dinner, the family can still talk about this. Extend your learning to your family related to drugs. Okay, next. Other than that, we have number 2, learning outcomes. The number 2 learning outcomes, can you still hear me?
Yes po.
Yeah. So, okay. Now, the number 2 is discuss toxic effects of the drug. Okay. I just want to ask you, when is the time that you will say that the drug reaches its toxic effect? What are those situations that we may say that the drug is already toxic to the body, if I may rephrase it? I know you have,
Allergies.
yeah, that's it. It means that the hypersensitivity reaction, the allergic reaction is a sign that the body's immune system is in defense against the toxic effect, and rashes, allergic, difficulty breathing are the effects of toxicity of drugs. So allergic reaction or hypersensitivity reaction is one. So any other situations or conditions which possibly may lead to toxic effect? Yes. Any other?
Overdosing.
Overdose. Very good. That's why you need to embrace mathematics. You need to embrace computation. Kaya when the toxic effect, kasi do you believe sa akin? Will you believe sa akin that toxic effect may lead to mortality, may lead to fatality? Will you agree with me?
Yes po.
Yes.
Yes.
So, just the same as when a person takes over and above the dosage, the liver may have the low capacity to detoxify. Kasi eventually, the one that I have mentioned to you when it comes to pharmacokinetics and pharmacodynamics, di ba, even a single drug that a person take, which is prescribed pa, the liver will take action pa to detoxify so that to safely distribute it to plasma. How much more if the person took overdose of drugs? So can you imagine that there will be a very forceful action or immediate action and function or overwork function of the liver? That's very true. So the liver is the one that will be damaged because of the overdosage. The other one is that of the two major organs that balances the body to prevent the toxic effect of the drugs is basically the liver and the kidney. Diba? I have mentioned to you that the liver is the one that will detoxify. Why the drug needs to be detoxified? Because each person may only have the capacity of the drug that will fit the person himself or herself. Kasi di ba class, usually, ang drugs ay kinocompute based from the weight of the client. All of us may have different weights. Very unusual that we may have the same weight. That's why taking the weight of the client is very relevant when it comes to computation of drugs. So it means that with that significant knowledge about the weight, then it supports the situation that the liver will function accordingly of what is the drug property that will fit the function of the person, physiologic function of the person based from the weight, the basic information about the weight. So, in this situation, what will happen to the excess properties of the drug? Will it best ba to stay in the body, or will it best to be eliminated from the body? Stays the body or eliminate?
po.
Yes.
Eliminate.
So it goes to the situation that if it stays to the body and it may not fit the physiologic function of the body, pwedeng mag-lead sa toxic effect. Tama po ba?
Tama po.
Yes. So what will be now the other organ? What will be the other organ that will support to remove the excess properties of the drug? Obviously, the kidneys. So the kidneys are the ones that will eliminate the excess properties based from the detoxification activity of the liver. So that's why the association of function between the liver and the kidneys are very significant in pharmacology. The purpose is to prevent the drug's toxic effect to the body. So all of us may have different response to drugs. And the two major functions, the liver and the kidney, takes the role of preventing the toxic effect. So now, in those situations po, if you will read books in pharmacology and even read some drug handbooks, do you know that most of the drugs are nephrotoxic and hepatotoxic drugs? So most of the drugs are hepatotoxic and nephrotoxic. So what does it mean? Most of the drugs are kidney toxic and liver toxic. So overdosage may give us the idea in the anatomy and physiology and through the concept of pharmacology that the overdosage will damage directly the liver and the kidney. So that's why whenever you will encounter situations of individuals with overdosage, observe in the hospital, they will immediately and initially test liver function and kidney function. Because in the case of overdosage, the supposedly and the normal response of the body, the kidney must eliminate the detoxified properties of the drug, the overdosage of the drug, and the kidney takes its action to remove and eliminate. So that's why it's very important for the person to eliminate it through urination. Pero how about if the person takes a drug that leads to unconsciousness? So it may not take the direction that it could be once the person experience the urge. 'Di ba doon pa lang tayo magi-initiate ng voiding. But for a person who is unconscious, even the urge is being initiated by the nerve. This may not initiate because the person is unconscious. So what will happen? The properties of overdosage of the drug stays in the body. So if it stays in the body, will it lead ba to toxic effect? The answer is yes. That toxic effect of the drug if it may not be eliminated by the kidney, it will be absorbed by the plasma, and that excess toxic level may travel to the different parts of the body, and it may cause extended damage to other organs. That's why it is basically fatal. Any toxic effects of drugs can be fatal if it may not reach of convention, it may not reach of emergency treatment and medical attention. So the basic knowledge on toxic effect, basic computation is very important. And then, sir, the most safe na lang is underdosage. Again, ha? Sabi mo kasi, sir, overdosage is the one that causes toxic effect and may lead to fatality. No. Underdosage may also lead to fatality. Why? Di ba? The dose itself fits the person to give to give the drug its effect to that person. So, if you have computed underdose and administered an underdose drug to the client, do you think you will reach the desired effect of the drug? The answer is no. If you will be giving antibacterial to the patient, will it reach the desired effect of preventing or inhibiting the multiplication or the increased replication of those bacteria and viruses? The answer is no. Kaya nga underdosage, it doesn't reach the desired effect. So if it doesn't reach the desired effect, it's not therapeutic to the patient. It may not lead to the desired treatment. So both concepts are of equal importance, underdosage and overdosage. That's why it's very careful. Some of you may say, I forgot to administer 5 ml of paracetamol at 8 o'clock. The next dose will be after 4 hours, 9, 10, 11, 12. Since I am aware that the dose is 5 ml, I will make it 10 ml. Will that be right? Will that be right, class? That you will double the dose since you have missed the supposedly dose of 8 a.m.? Will that be a right decision?
No po.
No po.
No.
No po.
No. That may not support that you will double the dose to support the missed dose of 8 o'clock. You are creating a situation of overdosage sa pasyente. Anyway naman, sir, it's already paracetamol. Wala namang namamatay sa paracetamol. In the concept of toxic, any overdose leads to toxic effect. Lalabas dyan adverse effect. The adverse effect is the untoward effect that is not expected. That is very alarming. The adverse effect is the one that is not expected. Kasi, di ba, you are aware of side effects and adverse effects. Side effects is expected. Okay? Expected effect of the drug. Okay? This supports that those side effects is a reflection that the drug is having effect. But the adverse effect is the one that is very alarming because the adverse effect is a reflection that the drug is not reaching its desired effect. It's either overdosage or underdosage. Now, if the adverse effect will be triggered, then that may lead to toxic effect. And that toxic effect may lead to fatality. So can you imagine the chronology of events na anyway, wala pa naman ako nababalitaang namamatay sa paracetamol. Pero remember, the concept of overdosage has something to do with safety, has something to do with the what we call overdosage pa rin. Because the desired dose is only 5 ml, but you double the dose in one administration. And that may lead to negligence. Okay? So what are the key understanding when it comes to toxic effects of the drug? Anatomy and physiology. Let us take care of our liver and kidneys. For those who may have, or individuals who may have problems with liver, who may have problems with kidneys, moreover, if some you have known na alcoholic, engaged in cigarette smoking, sometimes substance abuse. Those are the three that may trigger damage to liver and kidneys. And here comes the point. You will take a drug. There's a damage with liver and kidneys because you have been engaged into cigarette smoking, alcohol drinking. So you have abused the function of the liver and kidney. And here comes a point that you have been diagnosed with a severe health condition and you're about to take a drug. So do you think the liver and the kidney will take their function efficiently and effectively? The answer is what? Majority will probably respond. Yes or no?
No.
Ano?
Di na
No,
po, sir.
it will
No,
not
no.
respond
na.
because it has been abused that the liver and the kidney will not function. So that's why it's very important for all of us, even for you future nurses, to take care of your kidneys and liver because that supports, even if you take multivitamins, if you're taking now sodium ascorbate plus zinc or ascorbic acid. I just want to ask, what have you observed to the color of your urine whenever you take multivitamins or ascorbic acid? Is there
Yellow.
Yellowish po.
yellowish rather than
Orange po, orange.
yeah, sometimes orange, di ba? So because that is an indication that your liver and kidney eliminates excess properties of that drug. Kasi imaginein mo, 'di ba? You're taking multivitamins. Yung lahat ba ng components, kahit centrum yan, A to Z, do you believe, do you agree with me that the body has still reserve of vitamins and minerals? Do you agree with me? Has still reserve? Parang walang nag-agree. Do you agree with me? Yes.
Yes.
So now you will take multivitamins, which has also the components of complete A to Z. Will all of those components of the multivitamins ay need ng body mo? The answer is no. Kasi you have reserve. Tama po ba? You have reserve.
Yes po.
What will be the action of the liver? The action of the liver is it will separate those properties that may not be essential to your body function because you still have those reserve. Now, the liver will detoxify, the kidney will eliminate it. And the color of your urine is an indication that your liver and kidney have functioned with the effect of those multivitamins or ascorbic acid. Because probably 100% of the chemical properties of the ascorbic acid with zinc may not support all of your needs sa body because you still have reserve. So the one that supplements are the one that is lacking. Now, the excess of chemical properties of the drug will be removed via the liver, detoxified by liver, and will be eliminated by the kidneys. So that's why, kaya pala, my urine is colored yellow or yellowish every time I took or I take multivitamins or ascorbic acid or sodium ascorbate. That is one indication. So now, how about, sir, if the color of the urine is not the usual effect of the drug? It becomes tea-colored. Will still those observations be acceptable? The answer is no, because the usual initiation of the liver and the kidney goes with the effect of the color as expected, with the change of color on the boundaries only of yellowish. But if it is tea-colored, will it alarm you? Yes or no? Will it alarm you pag tea-colored urine?
Ibang kulay.
Yes.
Yes, kasi that is not the expected response of the liver and the kidney. Alam niyo po ba that the tea-colored urine is an indication that the kidney is starting to have its damage. So it's a basic it's basic knowledge for all of us and for all of you future nurses that the urine color has a significant relationship with the effect of the drug in the body? The answer is obviously yes. Will that be a knowledge for a nurse na very important when it comes to assessment? The answer is yes. That's why when you ask the patient when it comes to urination, di ba usually when you observe those nurses who will ask for the intake and output, ma'am, umihi na po ba kayo? Answer, yes. Ilang beses po? Then you're asking frequency. Then the second that you may ask, marami po ba? Or you're asking now the volume. Now, ano po yung color? Why you're still asking the color? Because the color itself will give you the idea if the color of the urine is brought about with the effect of the drug or brought about untoward effect of the drug. Which I have mentioned to you that the effect of the drug when you take multivitamins or vitamin C, yellowish in color, but if the patient will tell you it's not yellowish, it's actually somehow tea-colored and close to bright red. Will it alarm the nurse? Yes or no?
Yes.
Yes. So that's an indication that you will be alarmed. That is not anymore the normal effect of the drug. Then you will now put in your mind na since urine has a relationship with the urinary system, then I must assess the function of the kidney. So that's why even you will not be instructed by your doctors, you must initiate as part of the health team, sir, can we check the kidney function of the patient? Because upon observation and as assess the urine, the color of the urine is tea-colored. We are aware that the patient is taking vitamin C. However, a tea-colored urine is not a usual observation of its color as of its effect on the kidney function pertaining to the intake of vitamin C. So probably we could, I strongly suggest to have the test for the kidney to identify the extent of any problem identified with it. Wow, confident. You will be promoted even you're on the first day of your work. So, right, the one we are talking about now is it brings confidence with you when you learn these things, basic, but it will bring you confidence whenever you encounter situations like it. Okay, so naintindihan po?
Yes po.
Okay,
Yes
so
po.
isa na lang po, dalawa yung sumasagot. Baka the rest are not with me anymore. Baka
Yes po,
pagbalik
sir.
nyo, ayan, very good. Okay, thank you so much. So, this is the problem with the Zoom. I have not seen the, the whole screen. Anyway, third, so we still have only 9 minutes to go before you proceed to your asynchronous session. It's already 6:51, time check. Third, learning outcomes that we may consider in pharmacology is differentiate the steps of nursing process and their purpose in relation to drug therapy. So, I have told you that nursing process is very important to a basic competency, skills, competency, and knowledge of the nurse in the pharmacology. I have already introduced to you the basic concepts of pharmacotherapeutics, pharmacokinetics, pharmacodynamics, and toxic effect of the drugs. Then, with this knowledge, then nursing process is very basic, and there's very basic when it comes to the discharge of my responsibilities in medication administration. So, how we can consider nursing process? Example, when you are about to give a drug, I will give an example of a drug. Drug that ends in olol. Okay, olol. Okay. Don't get me wrong ha. I will pronounce it right. The drugs ending generic. So lahat ng may encounter, all of those drugs that you may encounter by generic, not the brand name ha. Drugs that generic names that you will encounter ending in olol. Propranolol, metropolol, atenolol, mention propranolol, metropolol, atenolol. So all ending in olol. These are drugs that are considered as beta blockers. Okay. Now, go back again to anatomy and physiology. If you have learned about the concept of beta receptors, the beta receptors, from the word itself, receptor, we are talking about impulse. If we talk about impulse, we're talking about nerve transmission. It's all about relaying message of what a specific organ will function or will do. The beta 1, or rather the beta 1, rather, if I'm right, beta 1, the beta receptor. The beta receptor, if it will stimulate beta receptor, it will increase heart rate. Okay? If the beta receptor will be blocked, then the action is it slows down the heart contraction. Okay? Now, concept of anatomy and physiology. The more forceful po ba ang pag-contract ng heart, the increase po din ng oxygen consumption and demand? Yes or no? The more forceful po ba ng contraction ng heart,
Yes po.
the more na increase ang oxygen consumption and demand? Yes or no?
Yes po.
Yes. So is there a possibility that if the heart will continuously have its force of contraction, it will increase oxygen consumption and oxygen demand? Yes or no? If it will continue.
Yes,
To have,
po.
yes, di ba?
Yes, sir.
Is there a possibility with that forceful contraction, the heart will be deprived already of oxygen?
Yes po.
Yes. So, if the heart will be deprived from oxygen, will it be a harm for the heart?
Yes.
Yes, sir.
Yes. If it will be harm for the heart, do you think what is the muscle of the heart? The myocardium. Am I right?
Yes po.
If the myocardium has a cell, what is the cell? Myocardial cell. Oo naman, sir. So, the myocardial cell, if the myocardial cell will be deprived from oxygen, do you think the muscle will not be effectively contract? Yes or no? Again, if the myocardial cell will be deprived from oxygen, will it lead ba to ineffective heart muscle contraction? Yes,
Yes
or
po.
no?
Yes
Yes.
po.
Yes, sir.
So, if it will have difficulty in the force of contraction and slows down force of contraction, will it be possible that it will stop contraction because of continuous deprivation of oxygen?
Yes, sir.
Yes. And that may lead to possibility of cardiac arrest. Am I right?
Yes.
Opo, sir.
Yes. And the cardiac arrest may lead to fatality. Am I right?
Yes, sir.
Okay. Now, you're aware what happens. Okay, what happens if the heart will continue to have its force of contraction? Now, give me example of situations wherein the heart will continuously have forceful contraction. What are those situations talaga na the heart will have forceful contraction? Normally, kung exercise, 'di ba? Kung exercise, that's a normal response. Am I right? Kasi you're engaged into physical activities, forceful contraction. That's a normal. But for a situation that a person who is resting and have forceful contraction and the person feels palpitation, will still that be normal?
No
The
po.
person is at rest,
Hindi po.
the heart is still having forceful contraction, and what is the indication it's not anymore normal? Palpitations. Have you encountered the term palpitations?
Yes po.
Yes
Yan.
po.
Yung palpitations, yan yung mga nararamdaman ninyo pagka nakakakita kayo ng crush, pag in love kayo, sobrang in love, pag kayo ay kinakabahan, palpitations ang tawag doon. But still at your level, when you feel those palpitations, nababalance siya. Nababalance. Because there's a reason. Because of adrenergic response. But can you imagine a person who's resting, who's not anxious, he's not feeling any excitement at all, pero the person is having the feeling of palpitation, kasi palpitation you can ano yan you can feel it na the forceful yung mabilis yung pag heartbeat. So eventually palpitation itself is an indication of forceful contraction. So eventually ang forceful contraction of the heart and palpitations pwedeng mag-lead into death from the discussion of flow of events that we mentioned. Yes or no?
Yes
Yes,
po.
sir.
Yes.
Pwede po.
Now, di ba, go back again to the situation. I have mentioned about those drugs ending in olol. Those drugs are classified as beta blocker. Oh, what does it mean ngayon? What does it mean ngayon? Pag sinabi nating beta blocker, from the term itself, block. It blocks the beta. Do you think pag na-block ang beta at kung forceful contraction, is there a possibility na ma-manage na yung pag-slow ng contraction to its acceptable force? Yes or no?
Po.
Yes,
Yes
Yes.
po.
Pwede po,
Yes.
sir. Pwede po.
Correct. And those are the drugs that are given for those individuals who are experiencing palpitations. Now, how the nursing process goes in. For example, the patient kasi pag beta blocker, eventually ang action niyan pag binlock mo yung beta, bababa yung heart rate. Tama po ba? Bababa yung heart rate kasi yun yung action niya. Now, as a nursing process is very important. You have taken the vital signs of your patient and the heart rate is 52. The heart rate is 52 or 50. Will you still give the drug? Will you still give the drug? The doctor prescribed that drug yung olol. For example, the beta blocker, prescribed siya dun sa patient. Then the nurse took the vital signs of 52. Will you still administer the drug?
No po.
Yes or no?
Hindi
No,
na
sir.
po.
No.
Hindi na
No
po.
po.
Oh, now, rationalize why. Rationalize why it must not be given by the nurse even though prescribed by the doctor. Why?
Pampababa po kasi ng
mababa na
blood
po yung dugo
pressure
niya.
yun,
Okay?
yung beta blocker.
Okay. Now, what will be your reference is the normal heart rate. What is the normal heart rate?
60 to 100 beats per minute.
Okay. Now, if it is below 60, it's beyond normal. Tama po ba?
Yes
It's
po.
a deviation. And that is what we
Yes.
call
Bradycardia po.
bradycardia. If ever the heart rate is 52 and you give the beta blocker, will it trigger much more lowered effect of the drug when it comes to heart rate? Yes or no?
Possible.
Possible? Okay. So kung mag-trigger yon, pwede bang mag-cardiac arrest ang patient? Kasi bababa na yung heart rate, binigyan mo pa ng beta blocker. Will that support na posibleng mag-lead into cardiac arrest yon? Yes or no? Ayun.
Yes.
Yes. Kasi can you imagine the vital signs is 52, lower than usual, it's deviation from normal reference, tapos nag-block ka pa ng beta, which is supposedly, di ba dapat yung 52 itaas mo papuntang 60 to the normal reference, pero nagbigay ka pa ng beta blocker that triggers slowing pa yung force of contraction kasi yun yung effect niya, binlock mo yung beta eh. So bumaba siya, and once it continues to slow down and delay yung response ng heart, pwedeng mag-lead na yon sa continuously mag-lower yung response at mag-cardiac arrest yung pasyente. Will nursing process be significant on that note? The answer is yes. The assessment of vital signs is significant and essential before administering the drug, even it is prescribed by the doctor. Remember, your action we must not depend on the every decision of doctors because we have our own competencies to identify if it must not be given. And that is our independent function because you are aware that may trigger specifically the health condition of the client. Do you understand po? Students?
Yes po.
Yes.
Yes
Okay.
po, sir.
So since it's already 7 o'clock, so I will stop my sharing. We'll stop my sharing. So did you find our discussion productive and you have learned something even though one slide? Even though it's only one slide, but it already took up some of the basic concepts of the pharmacology.
Yes po.
Okay, so thank you very much. So as what I have oriented you, that 7 o'clock to 8 o'clock will be for the asynchronous session. So when you visit your MCU BLE, you will check the asynchronous, and I have already posted the task there. You will just click the asynchronous topic 1 asynchronous, and you will be directed to a link for you to watch the video. And after watching the video, you will answer the assignment. So proceed to assignment, topic 1, then answer the questions. Those questions can be answerable in one hour because those questions are related to just enumerate tips of what you have learned from the video of understanding pharmacology. So I have note there, so you can access on the assignment, and those assignment, please convert it to PDF, and the PDF must be submitted at it ends with our time of 8 o'clock. If you may have difficulty of submitting at 8 o'clock because of some concerns, just notify with me, ha? If you may have difficulty of beating the deadline up to 8 o'clock, ha? Okay? So again, I am very much overwhelmed with your responses, with our reaction, and I'm more motivated with your responses every time that we will have interactive discussion. Thank you very much, and see you on our next discussion this coming Wednesday. The topics have been posted. You can watch in advance those videos and topics you may read so that the next discussion that we may have will be more productive. Thank you very much, and God bless all of you.
Thank you, Dean.
Thank you so much.
Thank you, Dean. Thank you po.
Bye.
Thank you po, sir.
Sir,
Yes, ma'am.
wala pa po akong subject na pharma sa BLE po.
Sa BLE, so probably you have not yet. Miss Lubian, you're the one who notified, right?
Yes po,
Sige.
sir.
So I will process it now. So just send me a message sa Messenger kung naka-enroll ka na, ha, or hindi pa.
Okay po.
Okay,
Thank you
thank
po.
you so much.